Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Deep sedation during ventilation can cost patients their independence, study says. Break and number 148. Patients placed on mechanical ventilation are commonly put under deep sedation, to ease the stress and discomfort of having a machine breathe for them. Break, but that short-term comfort might come at the cost of their long-term health. Break, people put under deep sedation during ventilation are 18% more likely to lose their ability to live independently, compared to those not provided such sedation, according to research published October 11 in The Lancet Respiratory Medicine. Break, the problem is that deep sedation inhibits patients from moving their bodies, causing potentially disabling muscle wasting, researchers found. Break and number 156. We found sedative medications were more likely to be delivered to patients to aid with sleep and rest, and number 157, senior researcher Dr. Matthias Eichermann said in a news release. He's chair of anesthesiology at Montefiore Einstein in New York City. Break and number 156. However, use of sedative medications can actually strip the exhausted patient of the healthy restorative sleep they need most during illness, and number 157, Eichermann continued. And number 156, our data shows this lack of quality sleep leads to greater rates of immobility in the ICU, which compounds into even more delirium and greater loss of the muscles and nerves needed during recovery. And number 157. Break, mechanical ventilation is provided to more than 300,000 Americans each year in intensive care units, ICU, with a machine moving air into and out of the lungs of people with severe respiratory illness, researchers said in background notes. Break, ventilators became one of the hallmarks of the COVID-19 pandemic, saving the lives of many stricken with severe illness. Break, since the pandemic, the use of deep sedation during ventilation has become more common among ICUs, researchers said. In deep sedation, drugs keep patients from being fully conscious, and they aren't easily aroused. Break, to see how this might affect patients, researchers tracked more than 10,000 people who lived independently prior to their admission to one of 20 Montefiore Einstein ICUs between January 2016 and July 2023. Break, all required mechanical ventilation for at least 24 hours in the ICU, and more than 70% received deep sedation while on a ventilator. Break, greater than or less than /speak. Speak results showed that people given deep sedation during ventilation were less likely to be able to live independently after leaving the hospital. Break, on the other hand, treatment of pain, anxiety or agitation with non-sedative or non-opioid medications was associated with a slightly decreased risk of loss of independence, the study says. Break, researchers noted more than 30,000 documented episodes of emotional distress among people on ventilation. However, high levels of emotional distress actually decreased the risk of loss of independence by 12%, rather than increasing the risk. Break and number 156, among patients who had emotional distress, treatment with medications that do not lead to deeper sedation was associated with a lower risk of loss of independent living, and number 157, researchers wrote. Break and number 156, the work supports the view that pain, anxiety, agitation and insomnia should not be treated with deep sedation, and number 157, the study concluded. Break, researchers at Montefiore Einstein have spearheaded a new multidisciplinary committee that is looking into ways to reduce the use of deep sedation during ventilation. Break and number 156, our hope is that the data published in this investigation will fuel national efforts to improve education about deep sedation and adherence to evidence-based guidelines, and number 157, Eichermann said. And number 156, the ultimate goal is to enhance overall patient care and help people return to the lives they want to live with their loved ones. And number 157. Break, sources Montefiore Einstein, news release, October 11, 2025. The Lancet Respiratory Medicine, October 11, 2025. Break disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. Break and copy, 2025 Health Day. All rights reserved. Break ad as a preferred source on Google. More news resources for MedWatch. Drug alerts. Daily med news for health professionals. New drug approvals. New drug applications. Drug shortages. Clinical trial results. Generic drug approvals. Subscribe to our newsletter. Break. Whatever your topic of interest, subscribe to our newsletters to get the best of drugs.com in your inbox. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.